Coming up next, find the help you need for postpartum depression. That's straight ahead on Long Island Naturally. Hi, welcome to Long Island Naturally. Irritability fades away after a week or two. My guests today know all too well how serious the postpartum depression can be and the devastating impact it can have on a young family. Recently, I profiled two Long Island moms who found help for their problem. Here's that story.
I found myself on the operating table, and I remember just crying. They were tears of failure, that I couldn't deliver my baby naturally the way that I wanted.
Fran O'Brien fell into a postpartum depression after an unexpected C-section and problems nursing her baby.
And I felt as though I had failed on so many levels.
Well, we've all heard of the baby blues. What hit Fran is far more serious. According to Sonia Murdoch, postpartum depression can strike any woman. She says it's the #1 complication of having a baby.
A lot of fear that women are experiencing and afraid to speak up, because if I speak up, will my children be taken away from me?
The Postpartum Resource Center operates a statewide helpline. Trained volunteers answer about 300 calls a month, offering emotional support, education, and resources.
Good afternoon, Postpartum Resource Center. We're trained to make an assessment on the phone of this mom as to what her level of anxiety is, and most importantly, we ask, how may I help you?
I was petrified.
What did you think was going on?
I thought I was going crazy. I thought that I was going to be one of these people that you hear about on television that go insane and kill their families.
Wendy Isnardi called and got the help she needed. Both women say their postpartum depression put a strain on their marriage.
I was afraid in the beginning with my husband. What does he need me for? I'm, hanging by a thread.
It can take your relationship and really tear it apart. Without him by my side, we wouldn't be here today.
We need to take a break, but when we return, we'll meet two women who got help and the head of the organization that was their lifesaver. We'll be right back. Hi, welcome back to Long Island Naturally. My guests are Fran O'Brien, a mom who sought help for her postpartum depression, Sonia Murdoch, the co-founder and executive director of the Postpartum Resource Center of New York, which is located in West Islip, and Vanessa Barisano, a registered nurse and a mom who also suffered with postpartum depression. She's now a bilingual prenatal educator for the Resource Center. Ladies, thank you so much for coming.
Thank you.
Vanessa, Fran, I'd like to start with you. At what point did you realize that you were depressed?
It probably, admitting that I was depressed was probably 4 months after delivery. The symptoms had really started right away, but I was uneducated and really didn't understand what was happening until, there were a few anxiety attacks and things like that, and I just wasn't myself. And so it was probably 4 months into it that I really started to seek help and admit that there was something happening.
You were a full-time working mother when you got pregnant. You were used to being very successful in your career, and I guess you expected to be successful as a mom.
Absolutely.
Right? What do you think, was there anything that triggered it? Was it the fact that you had a C-section? Do you think that was a major player?
Well, I think I'm such a planner. I'm organized. Everything has to be perfect in my mind. And so when those things go awry, and I didn't have the ability to make the adjustments and accept the fact that things aren't going to be perfect, that your life is going to be chaotic. I couldn't think straight to put things into perspective. And so, it threw me off guard that I couldn't handle these things, because I was always successful in what I did and put my all into it, but I just didn't have my all to give.
We have to get dressed.
So it made it very difficult to accept the fact that maybe I was failing.
Sweatpants.
Vanessa, you answer the hotline. What do women tell you? Are they finding that their birth plans are going awry just like Fran's did? Is that a major factor for a lot of women?
Well, actually, for a warm line, we have moms that call in and often do share that disappointment with their births, disappointment with themselves, and often that is a major player in postpartum depression.
What do you think women are looking for when they call?
Women, whether it's a mom that's seeking a help, it could be a spouse, it may be a grandparent, a friend, a sister. You'll be surprised. Just about anyone who is willing to help this mom calls the helpline. And they could be seeking information, just education about what is going on with their loved one. They could be seeking resources within their community, which is something that we will search for them immediately. It could also be perhaps just to speak to someone. And we do have trained women that we call Moms on Call. And these women do speak to our moms, and they will offer that emotional support and offer the hope.
Tell me about your experience, Vanessa. What do you think played a role in your becoming depressed?
Oh gosh, well, there are actually quite a few factors, I believe. I was working full-time as a nurse. That's how I identified myself with my career. And shortly after becoming pregnant, I chose to stay at home. And very early in my pregnancy, I made that decision. And I believe that the day in and day out of not having a job to go to really kind of started the entire the path for that. And I remember having my first panic attack very early in my pregnancy, not knowing that it was antepartum or pregnancy depression, and sharing with my OB that I'm having anxiety, that I'm having difficulty sleeping, and it was dismissed as just normal pregnancy. So of course I believed that that's what it was, until at the very end the symptoms became so much worse, where I would sleep maybe a given 2-3 hours a night, and the panic attacks were pretty much on a daily basis. And my hope was that, okay, this will pretty much subside when I have the baby, thinking, okay, it's just the hormonal changes of pregnancy, I'm going to be okay. And within 24 hours of delivering my daughter, I fell into a very deep depression.
Oh wow, so it got worse. So what are some of the other symptoms? You had anxiety. What are some of the other symptoms of postnatal depression?
For me personally, the anxiety and insomnia were the most prominent symptoms. And it wasn't just like, oh, I have a little anxiety and I can just like go about my routine activity. It was a debilitating anxiety where I could feel my heart racing. I could feel literally my arms and my legs would become numb. The shortness of breath and the chest pains were so severe that I would often take trips to the emergency room. And when I would take the trip to the emergency room, I would be given the $1 million workup, as they say, the whole cardiac workup. I would be sent home after learning that I was not having a heart attack, and it was pretty much okay, so you're okay. But I knew I wasn't okay. And aside from having the anxiety and the insomnia, there was that the energy. There was no energy. There was no energy. The fatigue was so overwhelming, and I wanted to hold my daughter. I wanted to feed her. I was so desperately wanted to feel that bond that I knew that every mother should feel, and it just wasn't there. And I knew that. And I knew that I would get to that, but I just didn't know how. And every day, day in and day out, the symptoms became worse. And initially I thought, well, it's just my hormones getting back to what they were when I was pregnant. But that day never came. That day never came, and my hormones never did normalize.
Yeah. I'd like to go through the list of symptoms that Sonia gave me. Frequent crying, sleep disturbances, which could be insomnia or excessive sleeping, appetite disturbances, anxiety or panic attacks, which obviously you had, over-concern or lack of concern for the baby, feelings of guilt or worthlessness, feeling overwhelmed or unable to cope, irritability and anger, loss of interest, fear of harming your baby or yourself. Wow, that's a scary one. I know that, does that happen that often, would you say? Did that happen to you, Fran?
I think I had a lot of those symptoms. I was more in the category of lack of sleep, insomnia, anxiety, fear that something would happen to my baby, not caused by me, but by others, or maybe some disease or something like that.
Right.
So I kind of overcompensated for that.
Sonia, why did you feel this postpartum center was needed?
Well, my family, we found out firsthand. My sister went through postpartum psychosis, the most severe form, and then severe postpartum depression. My co-founder, Emily Sampino, she also experienced very severe postpartum depression. Both of our families found that there was a huge gap. The information that needs to get to the families, the women themselves, the husbands, partners, was not getting there. Also, there's research information that needs to be shared, and educated professionals are needed. So we created a solution of the Postpartum Resource Center of New York to be one organization within New York State for families to reach out for the help that they need.
Do you think that part of the problem is that women think they're the only one with this problem?
Absolutely. Again, as you had mentioned earlier, perinatal mood disorders are the #1 medical complication related to having a baby. And with 10% of pregnant women going through a perinatal mood disorder, up to 20% or more postpartum, many women don't realize that it is so common, and on Long Island, over 8,000 families.
What are these statistics, Vanessa? How many women are having baby blues compared to postpartum depression?
The baby blues is a very, very high number. It's actually about 80%, and it's attributed to the very rapid transformation of the hormones after pregnancy. It's attributed to the expectations, or the unrealistic expectations of motherhood, like Fran described, the hoping that everything will be perfect, the visualization that everything will go exactly as planned. So given with and also very importantly too, are the lack of sleep, the sleep deprivation. So given all of those factors, postpartum blues is a very high number, it's 80%. So postpartum blues is 80%, postpartum depression is roughly about 20%, and antepartum depression is about 15%.
Fran, one of the things you mentioned to me that I had never considered was that family and friends, who normally are so supportive and excited about the whole experience, were not really supportive at this time, and frequently are not, because they don't understand what's going on. Is that the problem?
Right. I think it's very hard to understand. I couldn't put into words what I was feeling or express what was happening to me. Nonetheless, my friends and family really understand what was happening. They just knew I had changed and was very secluded when, in fact, I used to be a very outgoing person. So accepting that change and really understanding the lack of education by everyone, family, friends, medical professions, colleagues, it's very difficult because of the lack of education and the understanding, just like with a lot of, mental health illnesses.
Okay, well, that's what we're here for today, right?
That's
We're going to
right.
put up your number for the Postpartum Resource Center. We need to take a break, but we'll be back with more on postpartum depression and the resource center that helps rescue so many families. We're back with Fran O'Brien, a working mom who suffered postpartum depression. Sonia Murdoch, the woman who co-founded the statewide resource center and serves as its executive director, and Vanessa Barasano, a registered nurse and bilingual resource coordinator for the center. Thank you again, ladies. Tell me, Fran, how did the resource center help you? What did you get out of it?
The education, the fact that others had suffered as I had, understanding what I was going through and what it really meant for postpartum depression and what it means, and really putting the prevention plan in place with the birth of my second child, and understanding that there are postpartum doulas out there that can help once you come home with the baby. So I think just knowing that I had that phone number to call and knowing that Sonia was by my side, it really meant a lot. And I just wish that I would have had that for my first child, and that other women really know that it's out there, and families.
So you didn't suffer a postpartum depression with your second child, I gather?
No, I did not. I think we really had realistic goals in place, and understanding of what the birthing process would be, what to expect, understanding what could happen, knowing the signs and symptoms, and really putting the plan in place and educating others about what could happen to me, and knowing that Sonia and the Resource Center was by my side.
Okay, Sonia, what do you recommend is the ideal ideal treatment plan would women call?
The overall ideal treatment plan would consist of, first off, a complete medical evaluation, as well as nowadays research is more showing the importance of the nutritional evaluation, also psychiatric evaluation. In certain cases, medication may be needed. In severe cases, maybe hospitalization may be needed. Psychotherapy, as well as it's very important the inclusion of social support, meaning getting to a support group, online support, telephone support, peer support. From some women's standpoint actually can be what they feel is most important to their recovery.
Fran, did you take advantage of a support group? Did you do that?
No, during the first, I had no idea that a support group even existed. I had no way of finding out at that time.
And you run support groups, right,
Yes,
Vanessa?
I do. I run a support group that came out of my own experiences, so that I can get these women together, so that they can have one another, to have that support. They can feel that connection. That feeling of isolation is so devastating. So these women have each other to rely on, and it's peer-led. So it's and aside from the peer support, there's also the education component, and a very vital piece is we also bring in the support people. So we also bring in the spouses, the doulas, the babysitters, the grandparents, and I actually do that class with my husband, which is really something I'm very proud of. And we present as this couple who has gone through postpartum depression, has lived it, and is stronger from it.
Okay, one of the points I wanted to make, that I had the baby blues, and I later found out I was severely deficient in a number of key nutrients like vitamin D,
Right.
essential fats,
Right.
B complex.
Right.
Was that an issue for either of you girls?
Not that I've found out, during the process, but
Vanessa?
Actually, 14 years later, I've been recently diagnosed with a B12 deficiency, with an iron deficiency, with a gluten intolerance. Had I known that this was something that I was suffering from, I would have taken action, and perhaps it would have made a difference. But now knowing that, I think it's very important to really educate these moms about the nutritional aspect, and being a prenatal educator, I can do that. I'm in a position to do that, where I can really give them the tools and really tell them that nutrition during pregnancy is so vital, and you can really be in a position to identify what your risk factors are and what your nutritional deficiencies are.
Ladies, thank you so much. It's been great. I think you've been very helpful.
you.
I'm sure a
Thank
lot of
you.
women out there would be happy to hear they're not the only ones. I'm afraid we're out of time. Thanks so much for joining me. And thank you for watching. Please tune in each Wednesday for my weekly segments on alternative medicine and healthy lifestyle choices. I'm Mary Musi for Long Island Naturally. Enjoy the rest of your weekend.